Australia is facing a critical shortage of rapid antigen tests as waiting times blow out at PCR testing clinics. It comes after Prime Minister Scott Morrison ruled out making the test free, despite reports of price gouging increasing. Joining me live is Australian Medical Association Vice President Dr Chris Moy. Doctor, thanks so much for your time today. Did the Australian Medical Association warn the federal government that there would be a supply shock once the country started opening up for rapid antigen testing kits?
Well, it was more of a query to what seemed like a pretty obvious question, that we would need to transition over to rapid antigen testing at some stage. Certainly PCR testing when we didn't have much COVID, but when the Doherty plan came out, we were going to be allowing COVID in. So the obvious question was, what is the plan for rapid antigen testing? And clearly the reply was that there would be a reliance on the private sector because the government would not want to intervene where that could be the primary source. Now, unfortunately, in a health crisis at the moment, when we really need them, that reliance has failed us in two respects. Number one, we just can't get them, but also they are somewhat unaffordable for a lot of people. And what it's doing is it's really hampering this really critical ability for people to actually work out whether they're infectious. And therefore, it's hampering the whole effort to try and suppress the amount of COVID going through the community at the speed that it is at the moment.
When did you first advise the federal government that there would be those issues with rapid antigen tests?
Look, I'm looking back at the dates. It's at least September or prior to that, and I'm just checking that at the moment. But really prior to that sort of time period, because it seemed like such an obvious question when you're going to transition to living with COVID. So overseas, for example, in the UK, they've got really ready and free access to them for the most part to these tests. You pick them up at Woolworths, you pick up a pack of 5, or you get sent some from the NHS. My son's over there at the moment, and you email them and they'll send it to you. And what you do is before, if you're in a situation where you may have any queries about whether you've got any symptoms or if you've got any concerns about what you're about to do, like you're going to go into a aged care home or you're about to go into a large group, then you can do a test to actually determine whether you've got you're likely to be infectious. And that gets down to the key aspect of being able to apply personal responsibility during this critical moment when we've got so much COVID running through the community. Yeah,
so at the time, in September, what was the response that you received from the federal government?
Well, essentially that, and this was to the department, essentially that the reliance was going to be on the private sector and that the government did not feel that they would be intervening in where the private sector could provide this. Now, the thing is that they have got some, which is for the healthcare workers and sort of frontline staff. They certainly have some, but certainly the reliance on that private sector at the moment has led to a market failure, essentially, when we really need it, and that's the problem.
So back then, when they had a plan to open up the country, which would allow COVID to spread, they advised you that they would be leaving it up to the private sector and there would be no need to intervene with rapid antigen testing kit supply once we did open up.
Well, certainly the private sector would be significantly relied upon in this situation. And to be frank, at that point then one would have hoped that there would be a very close working with the private sector to get this ready so that they would be ready to go when the time came. It's pretty bleeding obvious that you need it, and it's pretty obvious to us now, but also obvious when you see what happens overseas with the way they've been applied, because really PCR testings are really what you rely on in a sort of a low COVID environment when you definitely need to know whether somebody's a positive. But in this situation here, what you're trying to do is work out whether somebody's infectious before they walk into a dangerous area or see somebody dangerous. And it's really important from an individual point of view to, as I said, apply personal responsibility to actually, they can actually decide, make sure that they're not infectious before they go somewhere dangerous. But also, amongst all that, it's critical part at this moment in time for people overall about trying to suppress the numbers overall in terms of the overall effort to slow down this COVID wave that we're experiencing.
Overseas, they've been using rapid antigen testing kits in other major countries like the UK and the US for a long time. Did the decision to delay the approval of rapid antigen testing kits in Australia until November play a part in this supply squeeze? And if so, should the government claim responsibility for that?
Well, I think there's a couple of. I know there's a lot of blame on the Therapeutic Goods Administration, and I think that's ridiculous. Because I've been getting I personally get all these people ringing me all the time, not ringing me, sending me emails like trying to sell rapid antigen for yonks, saying I should advocate for them. So they've been out there for a while, and they've been used overseas for a long period of time. So the approval process, I don't think, can be used as a blame. Should be blamed. I think the issue is that, okay, if it doesn't matter who provides it, but you've got to actually have several things. You've got to have enough of them. You've got to have good communication about how to use them, and you've got to make sure it's equitable so that everybody can use it in a really urgent situation as at the moment. Now, whether you go for private and you subsidise it or do something like that, you have to actually work with them so they're ready to go when the time comes. And this day has come. This day was always going to come. And unfortunately, right now, we're caught majorly short for an incredibly important arm of the whole response that we should have had ready. And unfortunately, we don't.